recruit, how are you going to recruit all these new foster parents? And you know, are you coming out anywhere close to a price tag on this critter? Because I mean, I'm just listening to this, and you are really ramping stuff up here. I mean, in ways that they need to be ramped up, obviously. But are you going to be able to, within 6 months, start giving us price tags on some of this stuff, I guess, is the real issue, because ultimately it will come down to dollars.
Yeah. So I think you're exactly right, that the fulcrum here, the limited resource, is the number of foster homes, especially when the validated approaches to treatment foster care limit greatly the number of kids that are available in the home. We're saying that we have only one or at most two kids in a home, and so that's going to greatly limit the number of kids that are going to be available. In terms of costs, I think we have really good numbers in terms of what it costs to put together a program like this, what the impact will be on offending for that group of kids, and what the impact would be long-term in the community. And I think it's driven by not overreaching. This is just like I don't want to go into open heart surgery because there's a flutter in my blood rhythm, my heart rhythm. I'm not going to want to throw treatment foster care at a kid who is having a small level of behavior problems. I think what we need to do is have a system of these interventions, and a system of these interventions that are talking to each other. Functional family therapy, a 12-session or less approach, empirically validated, has great outcomes. It revolves on keeping the kid in that home. When kids get more serious, multisystemic therapy has great outcomes. And then treatment foster care if the child has to be removed from the home. But if we can target, if we have enough capacity across the continuum to target those interventions where they're most needed, the cost per client to apply functional family therapy is a fraction of what it is for treatment foster care. We need to save those kinds of high-intensity interventions for the highest need kids, and that's where what I'd start with is a good assessment to know where those kids need to go along that continuum.
Just short follow-up. Okay. Can you differentiate between kids that go into foster care because of actions of the kids and kids that go into foster care because of actions of the parents? There's crossover, obviously, but there's also differentiation there. So,
my flip answer is that it's age. Younger kids come in because of the actions of their parents, and older kids are coming in because of the actions of their own actions. I think in terms of those kids, what we're seeing is a movement along that developmental continuum where their behavior is, they're acting out behavior, maybe the same kids, but what we're seeing is them penetrating, getting a larger peer group, and getting more and more adults upset with them because of their behavior.
Thank you.
Representative Wisnett, and then we'll get Council Taylor.
Thank you, Mr. Chair. Just a short one. You mentioned in your comments to Representative Shields about the success and the kin placement of foster care. This body in the last session and previous sessions have really tried to push forth legislation to influence the placement of foster children with kin or grandparents. Did you consider putting, so that is, can you confirm how good that is, and did you look at putting having one of your control groups be a foster child in a kin home or something?
Yes. So what basically it does is the disruption rate based on the number of this is a controlled study down in San Diego with regular foster care situation. We found that there was a linear correlation between the number of behaviors that the kid was producing on a daily basis with the disruption rate. So that kids who were producing 5 or more disruptions had an incremental increase in the likelihood they were going to disrupt from that home. And that likelihood dropped to relatively 0 if it was a kinship home. So if it's your grandkid that you have placed, they can act out a whole lot more, and grandma's going to be a whole lot more tolerant of it. Have we ever used that as a control group in any of our studies? No. For two reasons. One is what we work with in terms of, and also in terms of cost, is work with very short-term placements, 6 to 9 months. The other thing that happens when you train kinship placements is they keep those kids relatively longer and are more likely to keep those kids throughout time. And it doesn't work in a controlled outcome study to train them up and then we'd have to retrain. So we have not used that as a control group, but in naturalistic kinds of observations and in other kinds of population-based studies, they've used that, and kinship placements are incredibly strong and positive for the kids.
Thank you. Council Taylor.
Sure. Peter, are there evidence-based practices for foster care programs?
Yes. There's a number of evidence-based approaches to both the discipline within the foster home, in terms of kind of how to manage that. And what we're talking about is even beyond that, is then integrating also the mental health and behavioral health that the kid is getting outside. Because a lot of the foster programs that have some empirical validity to them are things that are working within the foster home, and then the kids are still, their treatment is still seen as something that's separate and outside of the home. And what we're trying to do is integrate the two, if I've understood your question.
One follow-up question, Mr. Chair. Do you know whether we follow them in the state of Oregon?
I think that there is an incredible push within DHS and child welfare to make sure that kids are getting, and coupling with mental health services and some of the HMOs. I can speak, that's more service-based, and I can speak to the Lane County, my experience in Lane County, that the rate of empirically validated services being delivered to kids is incredibly higher, and that caseworkers are getting more and more informed about what are the empirical validated. But there's also a capacity issue that we have to get the service professionals trained to deliver those services.
Thank you.
Any further questions? Senator Whitsitt.
Thank you, Chairman McPherson. Most of your presentation is targeted after the fact, and that's the world you deal with, obviously. But it appears to me that there's a near linear correlation between the reduction in discipline in families and schools and the increase in juvenile offenders. And we've got kids who are being taught in preschool what is appropriate discipline and what isn't, and not being pretty intelligent. These little kids are going home and telling their children, their parents, holding them hostage essentially regarding discipline. We see that in schools as well. Teachers are telling us, well, you do that, and I'm gonna write you up, whatever. So I guess the question is, and also in juvenile courts, in my opinion, the reason that they're successful is because there is discipline and there is immediate sanction if you don't follow expectations. So the question is, in our society, in our Big Brother society, are there restrictions in discipline having a negative effect on our society? Are there restrictions in discipline leading to a lot of this juvenile offense?
I don't know. I wish I had I don't have that. Within the work that I do, I don't really have the mechanism to get the data to answer that question, looking across time as to what's causal here. What I do know is that discipline, and several people have mentioned this earlier, that punishment and sanction-based stuff alone seems to exacerbate the problem. That one of the difficulties is that we have to combine those kinds of sanctions and making sure that kids are accountable with skill enhancement. If I'm going to teach a group of kids how to play soccer, I can't just punish them into playing soccer. I have to sit them down and teach them the skills necessary to do it. If we think that kids lack the ability to sit well in a classroom and sit in the class and follow the teacher's direction, those are skills. Those are skills that can be learned, and often they're skills that are absent. And so I think a punishment-only approach tends to miss the boat, and we need to focus our attention also on skill-based. Now, what's causal in society, I don't know.
Short follow-up. In your analogy with the soccer, the first thing you have to do is have enough discipline that the children listen to you. Mm-hmm. Because if you cannot demand their attention, you cannot teach them soccer. Mm-hmm. Just a comment.
Any other questions or comments? Peter, I'll make one request. If you could also provide your PowerPoint presentation to staff, that way we can distribute it out, would be wonderful. Thank you very much for coming up and presenting today. We're going to be taking a recess now until 1 o'clock. Both Director Williams and Jester will be back to talk about what's going on in Oregon. And Patsy, just for clarification, this room will be locked during the lunch hour. And so if you are planning on coming back and